Welcome to the Turtleshell Therapy Institute, a podcast made to help you learn how to feel more comfortable inside and outside of your shell. Hi, and welcome back to the Institute. I'm your host, James Nee Hundley, and we are joined today with Kirby Culbertson. Kirby is a certified yoga therapist with the International Association of Yoga Therapists. She and I are actually part of the same collaborative health collective here in Denver, and she's been a yoga teacher since 2014. Kirby, welcome to the Institute. I'm so happy to have you here to talk to us about yoga therapy and all the services you provide.
Thank you so much. It feels really great to be here. I am excited, to talk about yoga therapy. It's an amazing field. So, it's good to see you, or hear you, rather.
Well, to start, what is yoga therapy? Because I think most people have an idea of what yoga is, but yoga therapy is probably new for a lot of people.
Yeah, that's understandable. I think that the term yoga therapy is kind of a modern term, and one that's, I think, been created to sort of distinguish between varying degrees of training, mainly when it comes to therapy and yoga and knowledge around yoga. And it's kind of hard to exactly describe, I think, because similar to yoga, so many people come at it and approach yoga therapy from many different directions and perspectives. But if I were to boil it down, I would say yoga therapy is the specific application of yoga tools. Those can be things like postures, breathing, meditation, visualizations. Applying those tools to support an individual's physical, mental, emotional, and spiritual needs. So really addressing the fact that we are multi-dimensional beings. Like, we've got so many different layers to us, and yoga is so much more than, and I think a lot of people know this, or at least somewhat aware of this, that yoga is so much more than that asana or like physical practice of yoga. And that physical practice is a beautiful thing. I think it helps so many people with stress reduction, and it's really incredible. And a lot of like those physical movement classes that you'll go to, group classes, yoga classes, will include some breath work, but it's usually the physical and the breath somewhat that are addressed in group classes led by a yoga teacher, a yoga instructor, and a yoga therapist is more, I guess, more equipped to address a whole host of different ailments or areas of concern, and utilize a lot more different yogic tools than the average yoga teacher, or instructor. So your average yoga class is taught by a yoga teacher or instructor, and usually they have undergone about 200 hours of training. That is the requirement to call yourself a yoga teacher in, I guess, this country. But to become a yoga therapist, it's usually about, I believe the requirement is 900 or 1,000 hours of training. So yoga therapists just have a lot more tools, and I would say like background and understanding of the human system, both like through the lens of Western anatomy, but also through the lens of yogic models, in order to design practices that are more specific to an individual's needs. It's magic. I think so. It's a great, beautiful thing. Yoga therapy is and it's hard for me to say this, maybe because I am a able-bodied white individual who has no Indian heritage or South Asian heritage, but my understanding is that yoga therapy is closer to how yoga used to be taught, and yogic teachings used to be disseminated, a little bit more like personalized, specialized, one-on-one, having a teacher. And I think that there are absolutely incredible and amazing yoga teachers and instructors everywhere and anywhere. I think that, the field of yoga therapy is just trying to kind of be able to integrate, I guess, more into to become more of a complementary kind of medicine or modality in Western approaches to healing. So, yeah.
That's really interesting because like I didn't know anything about yoga therapy really, other than like I knew that you did it. Um, so it sounds like you get trained as a yoga teacher, and then there's additional training and more hours
Yeah.
to get to the yoga therapy piece.
Yeah. Yeah. I would guess that most yoga
yeah.
therapists started with the yoga teacher training. Yeah.
Okay. Well, and thinking too, even like, in the therapy or like mental health world too, I could see where this would be really helpful because there's a really big wave right now in mental health therapy looking more at somatic therapies, like getting more into the body, because that's an area that we've been missing a lot. We've been really good with the thoughts and the emotions, but we do miss the body.
Yeah.
And so there is more of a push, more of a need for that movement. And I think you're right too. Like my understanding of yoga, which is very limited, other than I've done yoga, I've gone to classes before, but I do know it's from a philosophy.
Yes.
So that would make sense that it would be more of a traditional, like one-on-one therapy, like when we think back more in like the traditional sense of where it started.
Yeah. No, yes, it's, I remember what led me into yoga therapy was learning about, I've been doing like a physical practice for a few years, and I learned about something called the yamas and the niyamas, which are essentially from the yogic texts, sort of an approach to, or an attitude one, should have towards oneself, and the attitudes one should have towards others and things outside oneself. And it rocked my world. I was so excited to learn that there's so much more to yoga. Yoga is not a religion. It's not, you can take what you like and leave the rest, I'd say. And anyone can practice it. It's an incredible thing. You said something else, and I wanted to comment on it, but I I forgot what it was. But
I was talking about body, like somatic therapies, how mental health, there's more of a push for therapies to get into the body. Yeah.
I'm so happy you brought up like somatics and somatic experiencing personally in my talk therapy. I guess that's how I refer to my work with a psychologist. In my talk therapy, I've gained so much from her training in somatic experiencing, as well as like parts work and various things. But yeah, it's so cool how many people are talking about how we store emotions and feelings and experiences in our body, like in our actual flesh. And, this knowledge and this wisdom about things being stored in our body that is ancient, and so many people have practiced over the years. It's so cool to witness like doctors and other people in Western medicine say, hey, there's something to this, and actually put together some pretty rigorous experiments that have shown some amazing things. So yes to bringing the body into like into more traditional therapy situations. It's really beautiful.
And what I really like about the idea of yoga therapy too, so actually, oddly enough, just today I was meeting with a client, and this individual is also working with some MDMA therapy while we are also doing EMDR therapy. And essentially, we talked about how both I and the other therapists are saying how he's doing very well. He's done very well with the cognitive piece and even the emotional piece, but getting into the body, because he can talk about the trauma a lot, but we were talking about that, and he was very, and I see this with a lot of people. Well, what do I do? What does that look like? And I think for some people, where I'm going with this, I think for some people just meditating and sitting can be part of it, but I also am thinking movement is so important, and that's where the yoga seems really cool, because there's movement,
there is.
You're not just sitting.
Yes, you're so right. And it just like the way you put it, where they're able to kind of access more cognitive and emotional layers. But the body work is a little bit less accessible. It just made me think of there is a yogic model called the Panchamaya model. And that is a lot of what yoga therapists do. They, after assessing a client, kind of pulling, I and my teacher calls it like pulling a client through the models to sort of like, identify areas of imbalance and areas that, are very strong or there's a lot of different yogic models, all in these like old texts that are still so applicable today. But anyways, I was thinking about that. There's in the Panchamaya model, there's different layers of our being, and at the center we've got like our bliss body connection to like that universality, like we're all one. The next is kind of more like personality. The next being like I guess kind of emotional. And the next is the mind, next is breath, and next is body. So body is the most like gross, and as you go in, there's more subtle layers. And so I was just thinking, maybe even just inviting them to take some breaths, deep breaths. Which, hey, can be really facilitated by, little arm movements and stuff. Mm-hmm. But yeah, I'm so excited to hear from a practicing psychologist that I guess therapist. What's the word that you would most use?
Clinical social worker. I'm a
clinical social worker. Exactly. Like here that's something that you think is lacking or would be very beneficial to bring into a traditional setting. Cool.
There's definitely a movement. Like I have two friends right now that are taking the somatic experience therapy training that through Peter Levine as the therapist that I know is like the big name in the in EMDR we talk about it, but that movement piece I think is really important because it's like I talk about with clients when we talk about getting into the body, it's uncomfortable to just sit. And I think too that's what I wanted to come back to was, you mentioned these are ancient texts, these are ancient practices. I really do think there's a reason there's more, I don't know if it's becoming a little more mainstream, but I think people are becoming more open to seeing the healing benefits of things like yoga and Reiki and body work. I know for me in particular, it's been huge for me with helping me with my own anxiety and depression. Just using Reiki, getting more than just a massage, like actually getting massage that targets certain areas. Like
yes. Yeah. I so agree. I mean, I'm able to feel comfortable enough to be on this podcast and like be doing the work that I do because of yoga therapy. Obviously talk therapy as well has been so incredibly helpful, but yeah, getting into the body is just, it's so invaluable and so important.
I saw on your website that there are 3 parts of a typical session with you. Could you tell us more about those and what each part would look like?
Yeah. So I would say most yoga therapists that do work one-on-one typically kind of have 3 parts to a yoga therapy session, and that involves like the intake or assessment, which is more like conversing and just like learning about their client, and also just kind of hopefully gaining some trust and helping them to feel comfortable and know that this work is going to be a safe container for whatever it is they want to bring forward. And then the second part kind of explores like that person's comfortability with various yogic practices, because it's so much more, like I mentioned, so much more than just the physical movement or the breath movement. There can also be like mantra, which maybe is a term you've heard, which involves like the power of vibration and sound. There's also different mudras, which are one of the types involves the hands. And just like what's the person comfortable with, and also really, I guess a part of the assessment is like, what is it that they're hoping to get out of this? Really kind of trying to figure out like what are their goals and how can we together like move towards them. Um, and yeah, so it's more like assessment and then kind of looking at range of motion and kind of going through a few practices to see what they might think of those practices. And then the third part would be the yoga therapist providing their client with a practice. So yoga therapy is different from a like a private yoga session with a yoga teacher. That those are great. They, in my understanding, can often be more focused on like the exercise of yoga and like getting a workout. That is not to say that's all of them, but typically a yoga therapist is working with someone to figure out what a yoga practice would look like for that person that they can do at home. Um, so it involves like some work, on the part of the client, which is where sort of some of the magic lies, which I can get to later. But yeah, that empowering of them with some of their own healing. Anyways, so yeah, in my sessions, my teacher is able to do all three of those parts of a yoga therapy session in 1 hour. And for me, it's pretty important after meeting a client, hearing what they're working with, and sort of understanding what it is they're comfortable with and what they are looking for. I like to sit and meditate for a little while on that and just really, yeah, let whatever's going to come through, and also pull it through more like my more scientific mind as well, and make sure that the practices that I'm going to offer them are the most appropriate. Um, yeah, so I do not do all three of those in one session. Usually it's like an intake. And we'll do the intake and kind of range of motion exploration, assessing where the person's at in the first hour. And then I will send them either a written out practice for them or a video of myself doing the practice.
Nice.
Yeah. I think for a while I was like hesitant to do that because I was nervous that I'd heard from a teacher that, someone can get like too attached to your voice. And I was like, you know what? People like to be able to hear and have it kind of timed out for
Yeah.
them.
Yeah.
I've found that it's more likely the person is going to actually do the practice than if you hand them a sheet of paper. Um,
Yeah.
but yeah, so, and then the third part would be kind of a follow-up call like a week later, which again, is helpful, I think, if you're pulling it through like behavioral science to get people to actually do the practice. So
Yeah.
every person that
Yeah.
comes to me has that intention to do the yoga practice. But for any of us who have practiced yoga, it is hard to get on that mat sometimes, myself included. So yeah, I in my past life, I was very into like behavioral science and what is it that like drives human behavior. And so I really try and pull that into designing practices for people and just trying to get them to setting them up for success. I'll often tie the practice that I've designed for them to something that they already do every day. So if it's like make coffee in the morning, I can put together a 5-minute yoga practice that they might do right at their kitchen counter. So you're actually going to do it because they say in yoga that it's like 99% practice and 1% theory. And there's so much theory. There's so much beautiful philosophy to it, but if you really want the benefits of yoga, you got to do the practice, which I
Yeah.
avoided for a long time. I think I got really into the books and the stuff and learning, which, hey, is a whole like path of yoga called jnana yoga, the yoga of knowledge. But yeah, you also have to have a practice. So anyways, I just talked a lot, but that's kind of what a
Oh no.
yoga therapy session would look like with me.
I love that. And what I love about it too is, like you said, you're setting your clients up for success.
Mm.
Like, I think, oh, and I'm sure, like you said, every yoga therapist will do it a little differently and have their reasoning behind it. And I don't know, like even for me, like I mostly meditate when I'm listening to an app and I have a voice and I listen to the same app and it's a familiar voice. And
Mm.
I definitely know my experience with yoga and Pilates, which only got into Pilates because I was in graduate school and I had a friend getting certified, so I just got free
Oh
sessions. but
yeah,
but it really helped me with the core. But whenever I would
I
do
hear you.
Pilates or yoga, I mean, I always found it very helpful to have the instructor because they would show me how to hold, where to hold my weight,
Yes.
like how to position myself, because I didn't know how to do that naturally, and have been great to have a video or a voice like
Mm.
walking me through it.
Yeah, yeah, cool. That's such like, yes, that makes so much sense. And to work like with a yoga therapist as opposed to being in a class with a bunch of people, obviously a yoga teacher is going to want to be able to offer like, personalized
Yeah,
instructions for people, but there's just not time or space for that in a group class. And so you can learn so much from, from a yoga therapist, very subtle adjustments around like, I think one that no, I'm not going to go down the road. But yeah, there's so much to learn. Yoga, there are a lot of like teachings around like doing a practice or a yoga pose perfectly, which my
yeah,
tradition or lineage that I'm a part of or identify most with rather is all about like function over form, and so
mm,
meeting people
mm,
where they're at. You're not trying to get to like a perfect downward dog. Maybe that's important for
yeah,
someone just because of a certain thing I've witnessed about their personality or yeah. So sometimes that can be used as a tool
yes,
to get towards perfection in something, and it depends on someone's age as well. But anyways, yes, it's all about like getting that um, appropriate and individualized yoga practice for you. So it sounds like, yeah, you were, I guess, hopefully able to get that with your friend who is studying
oh
Pilates
yeah,
and stuff. Just like that hands-on work is so
oh,
huge.
it was so beneficial.
Yes.
Well, and
Sometimes even just like a
the things,
little adjustment, it's like, oh, that's
yes,
it. Yeah,
yeah,
that's how, now I
yeah,
get it.
and being able to have, yeah, just even like when during the lesson, like where she was able to like put her hand, like people can't see where I'm putting my hand, but putting her hand on my back and on my stomach, and like, okay, move your weight here, and it's like you just said, you feel it.
Mm-hmm.
Well, and what I think is really cool, well, everything you're saying is really cool, and the parts I wanna, there are two parts. Just the idea when you said like just a 5 minute practice, because that I know for me, like and this is just my own like ignorance around it. When I think yoga, I'm like, oh, like what, a 30-minute hour workout, but you just doing something for 5 minutes and that can help you with various issues.
Yeah, yeah, huge, huge, huge. So I have
That's
worked with some
amazing.
people who already have like a daily practice. They already do it every day for like an hour. And I'm like, wow. And so we'll fine tune certain things. I'll add in different postures and breath work and visualizations or whatever tools that I'm going to use. But that's very seldom. Usually it's someone who's like, what's this yoga thing? My friend does it. I hear it calms me. Or it's someone who's like, I've tried physical therapy. I've tried all the things and nothing's working. So I'll try this weird woo woo yoga therapy stuff. It's interesting who ends up at a yoga therapist's door. But usually, like I said, behavioral science, you really want to set them
Yeah,
up for success. And it usually, when someone
yeah,
comes in, is like, I do not have a yoga practice, but I want to do an hour of yoga every morning. I'm like, awesome. Let's start with a 15 minute practice and just
yeah,
see how that
yeah,
feels for you. Understandably, some people can be like, wait, I'm paying for like a 5 minute practice. And, but you're paying for more than that. You're paying for also the
yeah.
relationship and also my, expertise of these are the appropriate practices for you right now, and they will help you find balance in X, Y, and Z or whatever. But yeah, it's usually shorter practices, and I would say I'm a different person. Maybe every like 10 minutes or at least every day, and so that practice and what's needed for more balance or healing. You never use the term cure or anything. Just
Yeah.
healing. like can change within a week. So, for the clients that I do work with over time, it's like a constant evolution, and we learn so much about them through, feedback of what that practice felt like for them and their body. And sometimes I get it wrong, obviously.
Oh
Sometimes
yeah,
it's like,
that's
oh,
part of
that did
it.
not feel good in your body. Okay. Or, ooh, you noticed that like it was
Yeah.
harder to fall asleep that night. Interesting. And so we learn from that together. And that's another thing just I wanted to mention. Most people, there's three things usually that you can categorize, like what people come to a yoga therapist for. We're hoping to either reduce pain, reduce anxiety, or sleep better. There's
Okay.
amazing stuff with sleep and yoga. Like, it's huge. And
Interesting.
so many people
I
with
had no
the
idea.
sleep stuff, it sucks.
Yeah.
Just like people be exhausted and they lie down and they can't sleep. It's like, I don't know, all kinds of stuff with sleep. But anyways.
Okay. Well, and that's what I was curious about too. What, because I know you said it can help with a whole spectrum of
Mm,
issues. Um, and before I get to that, just highlighting what you were just saying, like I really enjoy. I think this is great because setting people up for success is huge. I mean, that's why most people will come in with really ambitious and good
yeah,
goals, and making sure that you set yourself up for success because we're such a fast-paced culture. We just want to get to the destination.
yeah.
Um,
And it's so
so I
often like that one thing on your to-do list for the day that was actually like for you. That's the first one to
yeah.
get removed. Sorry, cut you off
Oh,
there, but
oh
yeah.
no, but
Oh,
absolutely that too. Like it's the first thing. So this making it like short, small practices that people can build on and
hmm,
expand on, and really love what you said about function over form because that also makes us so much more accessible.
yes, yes. Anyone can do yoga. Anyone can
Yeah.
do yoga. And yeah, I viscerally feel it right now. So yeah, the majority of like images of yoga that you see, at least
Yeah.
in this country, are able-bodied, skinny, white girls, and I,
Mhm.
somewhat fall into that category. And I'm really, it is my it is my I'm going to use the word duty. There's something else I can't remember the word, but it is very important that I learn about like decolonizing my yoga practice because
Yes.
it wasn't skinny white girls that came up with this, and everyone
Right.
benefits from yoga. Of course, the people that you see in these photos. I'm so excited that they're doing yoga. That's so awesome. I just wish that there was more visibility, and more teachers of South Asian descent that got like lifted up in the culture of yoga. And
Yeah.
yeah, if there's anything that if it's getting people to a mat and they're focusing on their breath in some way or another, I'm all for it. So like they like yoga booty,
Yeah.
whatever. Sure, that's awesome. It's awesome, awesome. Any type of yoga is great. I want it to feel and be more inclusive. There's this woman I think doing great work. Her name is Susanna Barkataki, and she is of South Asian descent. And yeah, she recently came out with a book. I think it's called Embracing Yoga's Roots, and it's just really kind of I think a part of her calling is to help people understand the importance of keeping the like philosophy and the yoga in yoga because everyone's heard of
Yeah.
yoga in this country. I went on a tangent. I'm sorry, but hi.
Oh, no, not at all. Because I'm really glad you brought up the decolonization piece. That's what I was trying to think. That
Mm,
was the term I was trying to think of earlier. Because I feel like all of these healing practices, yoga, the philosophies, they were there for a reason. And we're finding more and more with science, even how they're actually beneficial and they're actually helping now that we actually have science. And now that we actually have access to this research or people actually doing this research, which is huge because that's part of the
hmm.
decolonization process, making sure we're not looking at research only through a colonial lens,
Yeah.
which is usually like take a pill or move on.
Hmm.
For
Exactly.
me, like just being completely honest. And we got so I mean, go off on a whole thing about colonization because even like from an attachment,
right,
even even
we
from
could
an
go there.
attachment lens, yeah, it's just completely just it. Yeah, this whole idea of we have to be self-sufficient. Feelings are weak. You know, it's normal to not feel good or achy. Just push through and get over it. Like when we had all these practices from all of these different cultures before that were about community and connection and listening to your body, resting when it's telling you to rest.
Yes.
Yeah.
Listening to your body. Listening to your body. That is what yoga really helps with, you know, and there's so many cues there. We live so much of our world, our every day in this space of our head.
Yeah.
And what is it like to like drop down into your body, you know, which is a term used a lot in like, you know, various meditations and stuff, but it's real. It's an important phrase. And yeah, I just and it's just been an interesting thing and something I'm in the middle of, and will probably always will always be on that journey of being aware that I am, you know, benefiting so much from this amazing wealth of wisdom that I am right now making money by sharing with people, um, and just wondering about like appropriation in that space there. So, you know, I have received these amazing teachings and I'm very grateful for them and I want to share them. And yet, how can I, you know, like make sure that I'm giving back? So I think I actually am going to be, start donating some of everything. Some of all what's the word I'm looking for? Anytime I'm paid, let's donate a portion of that to something that helps rectify the appropriation of yoga. But
That's amazing, and definitely like it's so needed because I think that's happening in a lot of areas too. Because I think it's a ancient practice that we are bringing, well, maybe not bringing back, but at least we are in Western civilization. We are at least becoming more comfortable with or embracing.
Yeah. Yeah. And I think a lot of yoga therapists, you know, really want to honor the lineage or, the lineage of yoga that they have learned from. But you see a lot of yoga therapists also and yoga teachers taking from a lot of different lineages and kind of creating their own yoga, which I used to not. I used to be like lineage. Yes. I mean, of course, I'm so grateful.
Yeah.
But it's also been interesting because for so long, yoga could only be taught to men. And so a lot of these like more older practices are for men's bodies and their experience of moving through the world. And yeah, there's a lot more than just that. So this melding and taking what people like and leaving the rest, and I don't know, I'm opening up to it more. And also, I really enjoy bringing in like you know, I'm a scientist kind of. I love like just everything that we can know today about ways of healing. And so I bring in all kinds of stuff into my yoga therapy, being very aware that, you know, that is what all that I am a yoga therapist and I need to refer out when I need to refer out. I don't try to be like a herbalist or anything, but just like it can be so much yoga therapy. And it's a lot about like developing the relationship with a client of trust. So, nice.
Oh, totally. Well, and this might be a really big question, but so you mentioned those three main things that people come to with yoga therapy.
Yeah.
How does yoga therapy help? Like, how do the practices and the posture? How does that help with exhaustion and pain and?
Wow. Okay, so that would be more like I could talk about a case study to case study. Let's see, someone has pain in their knee, and they also like, let's see, they lost their dad died a year ago, and they still just feel a lot of grief from that. And they would usually describe themselves as like very outgoing and, willing to say yes to things, but recently they've just been feeling what they would call depressed, or down. Um, and so looking at that, I'd pull them through that's very basic and making someone into a few bullet points. But, with knee stuff, this is just me going off the top of my head, but let's say it's
Oh
pull it
yeah.
through the chakra model, which I really love working with. And the chakras are various like energy centers along in our body, and each chakra is associated with an element and with like various, I guess, what would be the word, like emotions almost, or characteristics, and also
Okay.
different like times of development for us in life. Anyways, um, knee, that's a big first chakra thing. So I might work on some like stability stuff. But at the same, and stability in terms of physical postures would be like really connecting to the ground beneath you, even like lying down on the ground if that feels right for them. Uh, but because they're already feeling down, they're kind of feeling like stuck and mired. I would want that stability to also be infused with some like fluidity, which is the second chakra. And so it wouldn't just be like, oh, let's get grounded. It'd also be like, let's lift up through various other centers of the body. And yeah, and grief is something that's associated with the heart chakra. All the other, all of the other emotions generally live kind of in the second chakra and that like watery flow of things. But the heart is like human connection and connection to the world around us. And so, yeah, based on those things, if I were to put together like a few just physical movements for them, there'd definitely be some what are called nyasam, which is like a gesture to the heart. If that feels like too much for them, if that makes them cry, we can work
Mhm.
next to that. We can do nyasam to the throat or to the belly, um, which would just be like inhale, your arms go wide, exhale, let's bring your hands to your heart and think of a moment that you're grateful for to have experienced with your dad. Anyway, so and then yeah, I could keep talking about it and pull it through various other yogic models. There's also like winds of the body, and there's rivers of the body called nadis, and marma points are beautiful to work with. Um, and so it really is about like kind of seeing what energetically a person needs and what physically a person needs, based on like the knee. I would also like, there's so many different knee things. So that was a bad example for me.
Okay.
So I would, assess their knee and find out exactly where the
Okay.
pain is and what movements, cause pain, and then find practices that they can do that, if they're more than 6 weeks out of like an acute injury, strengthen that area and whatnot. Um, yeah, so I probably should have come
Yeah.
prepared with a with a case study, but it really is about noticing what that person's dealing with, and then there's
Yeah.
just like a wealth of knowledge that I've been able to receive, and I also have mentors that have been doing this for many more years than I. So when I'm really stumped, I can ask them.
Yeah.
But yeah,
And
it's about finding balance, and there's a lot of importance, I think, in that intentionality. So instead of just
yeah.
doing like various stretches, like, oh, I'm gonna stretch out my hamstrings, it's like, oh, I'm doing this as a part of something that's healing me, and that's
Yeah.
really empowering for people. That's, I think, the biggest part of, sorry, I keep talking, but
Oh.
it's like a big part of yoga therapy, and why it's effective is instead of it like being like, oh, I need to heal this thing, I require a doctor and I require this medicine and I have to take that
Hmm.
medicine. I I rely on that. Whereas this, it puts some of the power of healing back in the individual's hands to actually like, hey, there are things that you can do. You don't have to just wait till there's like, a new
Hmm.
drug or something. I don't know. there's just, it's really empowering, and it taps into the individual's need for purpose and like meaning in life. I don't know. Yeah.
I thought that was a really good example, actually,
Oh,
because that's helpful to know too. There's different approaches, there's different models, and hearing that you do that assessment based on what you're feeling energetically, what's making sense for the person, like because I'm more familiar with the chakras just because I've done Reiki before, but
awesome.
but the other models too, like that's good to know there's other models that you might look at or different approaches. Yeah.
It's so cool. It's so cool. And you can layer them on top of each other. So like, there's like qualities of nature. And then even just noticing how someone's like, if they're depressed or they're anxious, notice just how they're holding their body. You can like pull that through a model. And it's just, it's so exciting, and I get really nerdy about it. But a person is so much more than that, and there is an element of like, intuition, somewhat. And like that's what I mean when I say like developing a relationship.
Yeah.
So, you said something, and I wanted to touch on it, but it's gone.
It makes sense too because the chakras are one that I know more of, and as I've been understanding that more, it is powerful to just understand the visualization, even the piece of it, like to just focus on a certain part of your body and just pay attention to that energy, and that we can do more. And there's more because of technology, there's more science showing that. Like science has now proved like an aura they call it a biofield, but it's the same concept of an aura. It's energy that we emit, and it can interact with other people's biofields.
I love it. I love it. Yes, because it's so important. Like some people, all they need is like, it's yoga, and it's like an ancient healing practice, and they're like, I'm down. I already love crystals. Let's try this. Whereas some people, like they're like, no, I need proof that this is going to work if I'm going to put my money into it. And so I'm so grateful that these studies are being done, because it opens it up to more people. And as the International Association of Yoga Therapists is really working on, just trying to make it, what is their mission? I wrote it down. It's to establish yoga as a recognized and respected therapy. And we need that, in the West, you need those studies that are well designed, not just like, in my class of 5 people, like with randomized controlled trials. So it's been really cool. What's happening, and learn about biofield/auras. If you need to call it a biofield, sure.
Sure, that's what we can call it, but it's the same thing as this ancient thing that's been around forever.
Cool.
And that's just awesome.
Do you practice Reiki, or do you receive Reiki? Or?
I have been actually going to Samantha in our building.
She's amazing.
So I've been working with her. No, it's been great, and she incorporates massage and body work too, which it just like, I don't know, like I was kind of in this little depression for a little while, and and like it just really released a lot too.
James is so happy to hear that.
It has. It's so as you were talking to, like, I know, like my my heart chakra was really heavy, and my throat chakra was pretty closed, and I think part of that was just the world's been so heavy. It's been so heavy and so tense that even that nervous energy of like, I'm working on being more confident in using my voice and not being so scared about saying the wrong thing. And I know that was a big part of that blockage that we were working with.
Yes. Even just to witness you saying that felt really good. Yeah. Oh, I'm glad that you found some like benefit working with Samantha. I think she's great. What is it? Mystic Massage.
Mystic Massage. Yeah.
She's great.
Yeah. No.
Here in Denver.
So good.
Just curious.
And actually, we will have an episode featuring her soon.
Awesome.
She will be coming on too. Yeah.
Cool.
Yeah. So she'll talk a lot more about her practice. But I highly recommend just the incorporation. And like you said, just getting into the body and I feel like we've known this at some point. Like, if our body is tense or holding something, that's going to impact our emotions and our ability to function. And
oof. Yeah, even just like, stretching like this after noticing that you've been like this on your computer all day, and there's
Yeah.
so much intuition there already. And that's hugely the
Yeah.
role of a yoga therapist. Like,
Yes.
I don't know, in yoga, the term guru is a beautiful word. It means like remover of darkness. Anything can be a guru. A flower can be a guru. You learn from it. But it's been like, it has a lot of bad connotations, I think, because things can get confused in yoga. When people start to feel better, they think it's because of their teacher, when it's actually
Mm.
because of the hard work they've been putting in. And I think that's really important
Yeah.
as a yoga therapist to keep in mind. Like, my job is to help people connect to that like inner
Yeah.
knowing and being able to work towards healing on their own. Also, I'm
Yeah.
always happy to be providing practices, because I have had the luck to be able to take the time and study all of these
Yeah.
practices. But yeah, it's about empowering the individual to take
Yes.
healing into their own hands. So yeah.
And it's actually really similar. Well, that's how mental health therapy is supposed to be, whether that's what happens. But I know that's how I was trained as a social worker and a therapist, was to work myself out of a job. Like, that's one thing I tell my
I
clients
love
too,
that.
is
Oh
that
yeah.
my goal is that you're not going to need me. I'm here to just teach you and empower you. And that's why I love EMDR so much too, because it's one of the
Mm-hmm.
first therapies that I know there's a lot more out there, but it's one of the first ones I ran into that really empowered clients to listen to their body. Because there's so much, part of EMDR too is to keep people actually within their window of tolerance.
Yeah.
And so I attune with them and I try to help that, but I'm also helping them learn, okay, when do you get to the out of your window of tolerance and you get flooded and
Mm-hmm.
emotional, and empowering you to be able to notice that and honor it, not just ignore it and push it push it down like so many of us are taught to do,
Yeah.
or shame it or judge it or
Yeah. EMDR has changed my life. It's an amazing practice. Mm. But yeah, like playing around at the edge of things, I think can be really special and important,
mm-hmm.
when it comes to trauma. And yeah,
Absolutely. But and speaking of access too, I did want to mention that you were able to do your sessions in person and over Zoom.
I
Is that right?
am. Yeah. So a
Yeah.
big thing yeah, at first I was nervous. I was nervous to work over Zoom, because a big thing that yoga therapists, myself included, utilize to read a person and where they are is noticing their breath, not just the length, but where it moves in their body, which over time, that's a skill that I've developed to be able to, just kind of witness in people. Um, and I was like, oh no, I can't do that over Zoom. But you can read so much over Zoom. I'm guessing you've experienced that as well as,
Yeah.
yeah,
Yeah.
like you can notice when someone, even like sometimes I can even notice if someone, like, I don't know, like gets ungrounded even. There's just
Yeah.
something that you can like
Yeah.
see. It's not just like that biofield that we were talking about. It's also like
Yeah.
witnessing
Exactly.
that. So yes, I do work over Zoom. I haven't done a whole lot of work over Zoom, but I am really enjoying the clients that I do see over Zoom. Yeah. Yeah, so I can work with people from anywhere.
That's awesome. And yeah, I have seen that too. I mean, the pandemic's what pushed me to doing virtual.
Mhm.
Well, I think it's what pushed a lot of us to it. But I have found it too. It's created so much more access for people. They're actually able to make the time for therapy or get to a therapist if they're in an area that doesn't have a lot of therapy. And
Yes.
you're right. Like,
Yeah.
I didn't think I would be able to read people as well, but like, you can. Like, it's,
Yeah.
especially when you get into that practice of tuning into people and noticing and witnessing, you can really see.
Yeah. Yeah. And yes, agreed. And there's the added benefit for me too, because, I utilize props just to make,
Mm.
you see that a lot in like Iyengar classes, yoga classes. But yeah, I use props for various things, just trying to make things work well for people. But it's interesting to be Zooming with someone because I can see where they're going to do their practice. And so I can be like, oh, let's
Oh,
actually utilize
yeah.
that chair there for these like heel slides or whatever it is.
Yeah.
And yeah, so it actually is really nice because then the person can like
Yeah.
set up their little space that they intend on doing their practice. And yeah, I think also some people are just more comfortable sharing when they're in their own home.
Mhm.
So,
Oh, totally.
but yeah,
Totally.
if
Well,
anyone is curious, like my information is all on my website, which is my name, kirbyculbertson.com. Yeah, and you can schedule through there. And even if you just have questions about yoga therapy and what it is, I'd be happy to answer them. Uh, there's also a great website resource for people. It's like one word, yogatherapy.health. You just type that into your bar, and yeah, it's from the International Association of Yoga Therapists, and you can find yoga therapists in your area through that. There's a great directory. That's the word. So yeah, but happy to answer any
yeah.
questions as well. So
Awesome. Awesome. Well, Kirby, I feel like I could talk to you forever. Thank you
no,
so much for being here. I've learned a lot and just really enjoyed hearing your perspective and what you do and how you do it. Thank you.
thank you. Well, it felt like such a great opportunity to come on here and get some James time, but also share about yoga therapy. I hope I've done it justice because it really is just like this amazing field, and there's so much to it. And I do believe and really hope that it becomes more accessible. Yoga, that IAYT, that group is working to have some insurances cover yoga therapy. We're kind of trying to follow
Mhm.
in the footsteps of like physical therapists, sort of, because PT used to not be covered by insurance. Anyways,
Oh,
yeah, I hope that it really can, yeah, be more accessible to more people soon. But thank you for
absolutely.
having me. I love
Of course.
I love getting the opportunity to talk with you, and I can't wait to listen to more of your podcast episodes. And yeah,
Oh, awesome. Well, you're welcome back anytime. I'd love to have
thanks.
you back. Once again, thank you to Kirby Culbertson for taking the time to sit down with me and sharing all of her knowledge and wisdom and training about yoga therapy and all the different ways that it can heal a whole spectrum of issues. I know I learned a lot today. I hope today was helpful for you. Again, if you want to learn more about yoga therapy and the services that Kirby provides, you can visit her website, kirbyculbertson.com. Culbertson is spelled Culbertson, and Kirby is spelled Kirby. Again, that's kirbyculbertson.com. I hope to see you next week, where I'm going to be taking a deep dive into the anxious attachment style and ways that you can manage your anxiety when you're in relationship. Take care and have a great week.